vision is to reach out to every individual who are suffering from similar disease with the best of the care.
We've been able to create an exceptional ecosystem which has created a significant impact at the grassroots level.
I'm Nimit Agrawal, founder of Doctco, a civil engineer, entrepreneur by heart.
My name is Colonel Parmar. I took voluntary retirement as a colonel and went to IIM Ahmedabad for my regular MBA. After this differentiating experience, entrepreneurship was the next logical step.
So Doctco is very personal to me. My sister was suffering from juvenile rheumatoid arthritis and it took 2 years for the diagnosis to happen, 2000 kilometers away in Chennai. I saw that I'm spending 40-50,000 rupees in one follow-up, while actual medical expense was just 10 to 15% of that. This can be saved for 350 million people who are living in these smaller cities.
More than 65% of the Indian population lives in rural parts of the country, wherein the healthcare infrastructure is still suboptimal. We in Doctco are trying to precisely bridge the super-speciality gap in more than 700 tier 2-3 cities and rural parts of India.
We have 10x more doctors when it comes to any of our competition. We are brand agnostic. When patient comes to our center, they will not be put across only one hospital, one doctor. On top of it, we have built a robust offline network with which we are able to generate a good quantum of organic patient at our centers.
One of the challenges which patients face in smaller towns of India is the trust deficit. One of the value proposition of Doctco is compassionate treatment for a patient right at his doorstep. We wish to reach out to larger number of patients so that their journey can be made comfortable and we can improve the overall patient experience for these people.
डॉक्टको में मेरा इलाज इतना आसान हुआ, मुझे पैसे भी कम खर्च करने पड़े और मेरा इलाज भी बेटर हुआ कि मुझे भागा दौड़ी नहीं करनी पड़ी। उनका एक बंदा मेरे साथ रहा 24 घंटे, उन्होंने भागा दौड़ी की और मैंने अपनी बीवी को पूरा टाइम हॉस्पिटल में दिया। जैसे कि अलीगढ़ में आज तक किसी डॉक्टर ने मुझे ये परामर्श नहीं दिया जो उन्होंने मुझे परामर्श दिया था।
So centers are very asset light. We onboard our existing healthcare infrastructure in local city. Once we do that, we empower them with 3 major facilities. One is we provide them a fintech solution. Second, we help them with an end-to-end cashless process. We provide access to super specialists. So these centers are equipped with state-of-the-art telemedicine solution, IoT devices. These IoT devices transmit clinical data in real time. And on top of it, we have a junior doctor sitting at our center. This junior doctor analyzes the patient, create clinical notes, and then we connect this patient with a super specialist. We have 4,000 plus options available, spanning from Apollo, Artemis, Fortis, IOSPL and others. If patient is coming with an attendant, even that we make sure that the overall experience, overall process is smooth. With Doctco Sathi, what happens is this Sathi takes care of everything end to end, from billing to appointment to getting in line, and everything happens by this Doctco Sathi, so that an attendant could stay with the patient. Moral support is very important when it comes to healthcare. We have seen that a lot of time patients are not being followed up because the attendant is not able to come. Even if just patient comes to our hospital, only patient, this Doctco Sathi will act as a family member for him. He or she will be taking care of the patient as his or her family would be. So that is the whole proposition around Doctco Sathi.
तो बहुत अच्छी बात ये थी कि यहाँ स्टाफ के यहाँ से फ़ोन जाता रहा स्टाफ से आपके कि आपने दवा अंकल खा ली नहीं खा ली, इस टाइम आपको दवा खानी है, ये करना है। तो मैं टाइम से दवा खाता रहा तो आज मैं 50% सही हूँ कम से कम। ना यहाँ टाइम खर्च हुआ, ना वाहियात रिपोर्टें कराई गई कि ज़रूरत है या नहीं है, लेकिन रिपोर्टें कराई है, ऐसा भी नहीं हुआ मेरे साथ। तो मैं क्यों ना भेजूँ किसी अपने का, अगर फ़ायदा होता है तो बहुत अच्छी बात है। कि खुदा करे कि आपका ये स्टाफ, आपकी ये संस्था बहुत ऊपर जाए, इससे लोगों को बहुत फ़ायदे मिलेंगे और आपका काम भी चलेगा।
During the second wave, we launched a bus service which was aimed at screening the patients for COVID in rural parts of UP. These buses were launched by Her Excellency, the Governor of UP, Mrs. Anandiben Patel. These buses traveled from village to village, and each bus screened almost 70 to 100 patients every day. We ran these buses over several months, thereby screening more than 100,000 patients within UP, ensuring deeper penetration and providing healthcare delivery right at the doorstep. And we were able to make a difference at the last mile in delivering qualitative healthcare delivery to the needy patients.